Hello, hello, hello. Likely to discuss about this. Okay, if I'm talking about this part, this electrophoresis pattern in the sickle cell syndrome, this electrophoresis pattern of this sickle cell syndrome, in normal, hemoglobin A is more than A2, then some of the hemoglobin F is present, but there is no hemoglobin S. Hemoglobin S is present only in sickle cell trait, sickle cell anemia, and sickle cell patient on hydroxyurea. Also, hemoglobin S disease, also in hemoglobin S disease. Okay, in sickle cell trait, what happens in sickle cell trait? Hemoglobin A is low, hemoglobin A2 is also low, hemoglobin F is present, but there is more hemoglobin S, and hemoglobin C is absent. In sickle cell anemia, there is no hemoglobin A. This is high yield. In sickle cell anemia, there is no hemoglobin A. In sickle cell patient on hydroxyurea, there is presence of no hemoglobin A. Hemoglobin A2 is present. Hemoglobin F is present, and hemoglobin S in sickle cell anemia is much more, but there is no hemoglobin C is on hydroxyurea. In sickle cell patient on hydroxyurea, we know that hydroxyurea increases fetal hemoglobin, hemoglobin F. So hemoglobin F is more than the hemoglobin A2, and that's the difference. And the last one, hemoglobin SC disease. In hemoglobin SC disease, there is no hemoglobin A, presence of hemoglobin C, also presence of hemoglobin S, and A2 is also present. That's the thing about sickle cell syndrome. When you do electrophoresis, you'll find this sort of pattern. So, sickle cell patient on hydroxyurea, what should be the electrophoresis? There is no hemoglobin A, there is presence of hemoglobin A2, there is presence of hemoglobin F, and there is presence of hemoglobin S is much more. There, sorry, hemoglobin S is much more, but the sickle cell patient on hydroxyurea, hemoglobin F is much more than the sickle cell disease, because we know that hydroxyurea increases fetal hemoglobin. So, two things: hemoglobin A is near about zero, hemoglobin S is also present, hemoglobin S is much more present, hemoglobin F is also present, and there is no hemoglobin C. There is no hemoglobin C. Okay, this is sickle cell disease. This is sickle cell disease. In sickle cell disease, there are an absence of normal beta hemoglobin. There is normal beta hemoglobin. The sickle cell mutation generates a new type of hemoglobin, hemoglobin S, which polymerize when deoxygenated. This leads to reduced erythrocyte deformability and increase erythrocyte fragility and increase erythrocyte fragility and increase erythrocyte mm, and increase erythrocyte fragility. These leads to reduced hemoglobin. This leads to reduced erythrocyte deformability, increased erythrocyte fragility, and causing painful vascular occlusion, causing painful vascular occlusion. Because patients with sickle cell disease are unable to generate normal beta hemoglobin, they will only produce hemoglobin A. Therefore, hemoglobin A will be undetectable. Hemoglobin A will be undetectable. Hemoglobin A is undetectable. Other forms of hemoglobin that do not contain beta globulin that do not contain beta globulin hemoglobin A to and F are generally present and present at normal or mildly as the patient is on hydroxide. There is increased fetal hemoglobin or hemoglobin F, often administered due to reduced sickle cell disease complications. Patient who responds to hydroxyurea, as in this patient, these reduced symptoms, and usually 10 to 30% of the hemoglobin F on electrophoresis. Macrocytosis. Side effect is macrocytosis and myelosuppression. Macrocytosis and myelosuppression. Myelosuppression.